Allergy season is in full swing here in Western Washington, and the beautiful weather over the weekend didn't help much.
Yeah, things are really starting to bloom, and that doesn't help. Joining us this morning to talk more about allergy season is Dr. Kevin Dooms from Swedish. Good morning to you.
Thank you for inviting me.
So is it officially allergy season at this point?
It is. It's been allergy season for a few weeks already.
And so what does that mean, and what does that bode for this season? What do you know about the forecast?
So any season depends a lot on the weather. So early in January we had some warmer weather. We saw some trees pollinate early. It got cool in February, so things cooled off. And then this past week or so we've seen some warmer temperatures and the pollens got really high. We've already had some high and also extremely high pollen levels, including yesterday. We had very, very high levels yesterday.
Yeah, because things just bloom up, right? That warm weather stimulates it. So what specifically should we be aware of right now?
Tree pollen. So right now the major pollinators are alder and birch trees and also cedar.
What's the best thing to do if you have allergies?
Well, it helps to know what you're allergic to and be able to anticipate the seasons. So as I said, it's the tree pollen season now. Later in the spring, it'll be the grass pollen season, usually in May and June. It helps to get an allergy test. That's one way of doing it. And we recommend to our patients that they be able to identify their allergies and know when to expect it and then treat it later.
Yeah, well, that Zyrtec sure works well.
Great medicine.
I live on that stuff in the summer. I'm actually a little under the weather-ish right now, and I know it's not allergies, but sometimes they're pretty similar symptoms, right? How do you know the difference?
It's true. So allergies and common colds often are very similar: congestion, runny nose, sometimes cough. But if you have a fever, sore throat, body aches, think about colds, flus, and not allergies. And also if you have allergies, you kind of know it. You know, it's the season, it's warm, there's pollen out, and you should expect to be allergy.
So if you do have allergies, do you buy over-the-counter medication to help yourself, or should you see a doctor?
It's true. So Zyrtec is an example of an over-the-counter antihistamine. It's a great time for patients now because we have over-the-counter, inexpensive antihistamines. Nasal steroid sprays have moved over the counter. No prescriptions required for those.
So that's fine?
That's fine, yeah. Actually, we used to use those in our practice, but now they're available for patients. Just pick it up Costco or anywhere else, too.
That's what I was going to ask, too. So anything else other than over-the-counter medicine that works? I've heard once before that local bee pollen is good as well. Is that just a myth? Am I just...
There's not much evidence to support that.
Oh, I thought that was so clever, though.
No, it's a long explanation. I'm also a beekeeper, so I can give you a long story.
He does know the answer to that. Okay, so if most people can just go and get over-the-counter medication to help, find some relief, when should someone see a doctor?
So if you've tried all the things, you know when your season is, you try to avoid it, you watch the weather, you tried all the medicines, you should see an allergist then if things aren't working out.
All right. Dr. Kevin Dooms, thank you so much for giving some advice on allergy season. I think the rain sometimes helps wash things away, so let's find out if that is in the forecast.